You know the warning signs of someone having a stroke? Is there anything we can do to lessen the chance that we'll have a stroke someday? Some help with that today on Weekend Connection. My name is Mike Dyes. Now, let's get connected. In a recent year, an estimated 1 in every 6 deaths from cardiovascular disease was due to stroke. It's also estimated that in the U.S., someone has a stroke about every 40 seconds. And every year, about 800,000 people have strokes in the U.S. What can we do to lessen the chances of suffering a stroke? What are the warning signs? Well, to help us with these and other issues related to strokes, it's Dr. Mary George, the Deputy Associate Director for Science and Senior Medical Officer for the Division of Heart Disease and Stroke Prevention at the Centers for Disease Control and Prevention. Dr. George received the American Stroke Association's Community Conscience Award for her work in improving stroke care, and has authored or co-authored numerous publications and book chapters. It's a privilege to have her join us today. Dr. George, welcome to Weekend Connection.
Thank you very much. It's a pleasure to be here today.
For those of us who have loved ones who have suffered strokes, it really is an alarming experience to see somebody go through that. And then the recovery process, it really is something that alarms us, isn't it?
Yes, it is a life-changing event, not just for the person having the stroke, but their family and loved ones as well.
Well, let's start with a definition of a stroke.
There's a couple of different kinds of strokes that affect the blood vessels in the brain or the blood vessels going to the brain. Most strokes are caused by a blockage in one of those blood vessels. And when that happens, that part of the brain is no longer getting oxygen and other nutrients that it needs. Other strokes are caused by a blood vessel in the brain rupturing. Sometimes that can be due to high blood pressure. Sometimes it's due to something called an aneurysm. An aneurysm is a swelling on a blood vessel. And that aneurysm can become weak and rupture.
I think someone who feels as though he's pretty much in control then has to deal with a loss of control in the recovery process. It really leaves us in a very vulnerable place, doesn't it?
Yes, it does.
Well, let's talk about some of the warning signs. Are there some things that we can look for and say, hey, this is something I need to pay a little more attention to because of my own health? What are some of the warning signs?
So stroke symptoms tend to occur suddenly. Sudden difficulty moving an arm or a leg, sudden difficulty walking, difficulty speaking. They may appear to have a crooked smile, may have trouble seeing, or a sudden very severe headache. The reason why these symptoms can be so different is that it depends on what part of the brain is affected by the stroke and what type of stroke it is.
Now, does someone going through a stroke, experiencing it, do they typically know what's happening, or are they unaware that there's any problem at first?
It can be either one of those situations, and that depends on what part of the brain is involved in the stroke and how severe it is. Sometimes a stroke can occur where someone doesn't recognize one side of their body, and they'll insist that they're perfectly fine because they don't know that they can't move an arm or a leg. So some strokes, as I mentioned, produce a very severe headache, and the person is going to be very aware of that. But if a stroke typically affects difficulty speaking, people will by and large recognize that. If they suddenly can't move an arm, they'll typically recognize that.
Our guest is Dr. Mary George, Senior Medical Officer for the Division of Heart Disease and Stroke Prevention at the CDC. Now, I came across FAST as being a key to recognizing when someone's having a stroke. What is the FAST, and how does that help?
So F stands for face, and I mentioned having a crooked smile. That's what the F represents. The A stands for arm. Could be a leg, but in FAST, it stands for an arm. They may have trouble moving an arm. S stands for speech. A person may have garbled speech, other difficulties trying to speak. And T stands for time. Time is really of the essence. When someone has a stroke, they need to get help right away.
How much difference does it make to know those warning signs and help somebody get to the doctor quickly? Does it really make a big difference in the recovery process, how quickly we're able to get them to the hospital?
Yes, it makes a really big difference. If you see someone having any of these signs of a stroke, it's really important that you call 911, that they get to the hospital right away. And calling 911 will help ensure that the stroke treatment starts sooner. The sooner a stroke is treated, the better the chances of a good recovery.
Well, we hear a lot about the pandemic, COVID-19, and all the things related to that. Is there any connection between that and strokes? Are they related in any way, the coronavirus and strokes?
There have been several reports of people who are hospitalized with COVID-19, and then they develop a stroke afterwards. And that is because one of the things that happens with the COVID-19 virus is that it can produce blood clots. And those blood clots, if they were to occur in the vessels going to the brain or in the brain, that can produce a stroke.
Well, let's talk a little bit about who's most at risk for a stroke. Would it be safe to say that older folks are more at risk than younger ones?
So a stroke can occur at any age, but the risk for stroke increases with age. So we see more strokes in older people, but there's several risk factors for stroke. The leading risk factor is high blood pressure, also called hypertension. Other important risk factors include diabetes, high blood cholesterol, tobacco smoking, having an irregular heartbeat, known as atrial fibrillation, eating a poor diet and not being physically active, and consuming too much alcohol. Beyond those common risk factors, some gene studies have identified some variations in genes that also predispose to having a stroke, but that research is ongoing.
Okay. We mentioned older and younger folks. What about gender? Do women or men, do either one have more likelihood of having a stroke?
Because strokes increase with age, and women tend to live a little bit longer than men, they will have more strokes in the older age group. Men have more strokes at a younger age group.
What about certain ethnic groups? Does it create a higher risk depending on the ethnic group?
Yes, African Americans have much higher rate of having a stroke and dying from a stroke.
Well, our guest is Dr. Mary George, Deputy Associate Director for Science at the Centers for Disease Control and Prevention. Now, let's talk a little bit about recovery. We've talked about what can be a danger sign, what the definition is for a stroke. What about the recovery process? How do we deal with patients once they've had a stroke? What's that process like?
So most people who have had a stroke are going to require some type of rehabilitation, and that can involve physical therapy, speech therapy, occupational therapy, and that can go on for quite some time in order to maximize the recovery from a stroke.
I know in my family, a family member who has gone through a stroke, it seems that his speech has never recovered quite to where it was before, and his balance is an issue. Are those common long-term effects of a stroke?
Yes.
All right, well, let's talk a little bit more about the prevention. You mentioned some of those things. What about eating? should we think about as far as the preventing strokes? What are some of the tips you'd give on proper eating?
So we recommend a heart-healthy diet, and that diet, which is good for the heart, is also good for the brain. Low in salt or sodium, low in saturated fats, high in fruits and vegetables, limiting alcohol, maintaining a healthy weight and being physically active, as well as managing your other risk factors, such as high blood pressure and high blood cholesterol, are all important for preventing strokes. A good portion of strokes are probably preventable, and certainly diet is a good part of that prevention.
Our guest is Dr. Mary George, Senior Medical Officer for the Division of Heart Disease and Stroke Prevention at the CDC. How can we find more information? Where should we go to find out more about the cause, the treatment, the prevention of strokes?
There is a lot of information at cdc.gov. And there's a search bar at the top on that page, and you can just put stroke in, and it'll take you to a number of different resources at CDC about stroke.
Well, it might be good here at the end of the program to reinforce those FAST signs, so that if we have a loved one, or maybe we ourselves are seeing those symptoms, give those to us one more time, the FAST signs.
Certainly. S stands for face, where you might see a crooked smile. A stands for arm. Someone may have weakness in their arm or a leg. S stands for speech. Someone suddenly has trouble speaking, or you can't understand their speech. It's time to call 911.
Yes, and you mentioned the fact that when you call 911, the treatment can actually begin sooner than if we were to drive that loved one to the hospital ourselves. So something to keep in mind, that get them to the hospital quickly, one way or another, so they can get some treatment. Again, our guest, Dr. Mary George, Senior Medical Officer for the Division of Heart Disease and Stroke Prevention at the CDC. Well, thank you very much for sharing your expertise, your knowledge with us here at Weekend Connection.
Thank you.
My name is Mike Dyes. Join us again next week here at Weekend Connection.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.